As vulnerable Ugandans prepare to receive the relief fund from the government tomorrow, today we spoke to several members of parliament in regard to the lockdown and how it is treating their various constituencies. These have noted that their electorates have been affected heavily and so a quick response is needed. According to Honorable Charles Tebandeke, representing the people of Bale, the current lockdown can't be managed by only the President and the Prime Minister, adding that other agencies too have to be involved.
Right now, it's an abomination that the entire country, the citizens and their leaders are all under prisons of lockdown. And it's very enormous to convince that the President alone and the Prime Minister shall strongly torch out all the grievances, challenges in different specific geographical areas that are encumbering different challenges to solve their issues. The President allowed all the tourists, after being immunized, to come into the country and exercise their rights and duties, contrary to the members of Parliament who have already been vaccinated but have no chance to convene and discuss on matters of national importance.
In the same line, Honorable Serubula Stephen, who represents the people of Lugazi municipality, noted that the status of his constituency is undesirable, being that even the health sector is affected, and so a lot is needed to beef it up so that Ugandans in his area can survive, as he called upon Parliament to quickly respond to his plea.
We are not any better. The COVID crisis is too immense in Lugazi. We are having our hospital, that is Kaolo Hospital, and the challenges are many in Kaolo Hospital. We don't have an isolation center. Our doctors are working under hard conditions. They're not being facilitated. And secondly, the poverty levels of our people, they cannot stay home. You find them roaming in town trying to look for what to eat, obviously. So the government's facilitation of giving people food is not working at all. They have not yet started. And even people, for example, the border people who would have tried to get money, obviously, they limited them to only carrying luggage.
Honorable Chirumira Hassan, Member of Parliament for Katikamu constituency, has noted that a lot can be done to save Ugandans from this deadly pandemic.
COVID has essentially antagonized the social dynamics and traditions of our country. We need to know that it's a disease it's here. At the same time, it is our responsibility as a country to fight COVID. We are not going to fight COVID by locking people at home. We need to fight COVID by bringing vaccines to the people of Uganda. We need to fight COVID by testing people in their respective constituencies, in their respective homes. But this whole analogy of locking people home without any kind of care, we need to care for our people.
Honorable Nyakato Asinansi, Member of Parliament for Hoima District, has urged her electorates to observe the standard operating procedures and follow the guidelines from the Ministry of Health in a bid to curb the spread of COVID-19, among others.
Calling upon government to come to a rescue of the Regional Referral Hospital of Hoima, where we don't have oxygen, where we don't have water for the last 3 weeks, where we don't have a CT scan. In case someone has come in and they need a CT scan, you're being referred to Mulago. We need medicine. We need our doctors to be paid. For the last 8 months, they have not been paid up to now, even the cleaners. So government should take this issue as an urgency of national importance.
This story has been compiled by Issa Chigongo for Channel 44 Prime News.